Peripheral artery disease, or PAD, is one of the most underdiagnosed and devastating conditions out there. Every year, thousands of people lose their limbs, not because PAD can't be treated, but because it's caught too late. As a wound care physician, I've seen firsthand how early recognition and intervention can save not just limbs, but lives. By the end of this video, you'll know exactly what PAD is, why it's missed so often, and the steps to prevent it. For those who don't know me, my name is Dr. Voltaire, and I've spent years working at the intersection of wound care and vascular health. For healthcare providers or anyone dealing with PAD, I also run the Wound Fit community, where we go even deeper into these challenges with tools, tips, and support to improve outcomes. You'll find the link in the description. Let's dive in. PAD, or peripheral artery disease, happens when the arteries that carry blood to your legs and feet become narrowed or blocked by plaque, a buildup of fat, cholesterol, and other substances. Think of it like a clogged pipe. When blood flow slows down, your tissues don't get the oxygen and nutrients they need. This leads to symptoms like leg pain while walking, wounds that won't heal, and even gangrene in severe cases. But here's the thing, most people with PAD don't notice any symptoms at all until it's too late. Studies show that up to 50% of people with PAD don't even know they have it. Why? Because the early signs like leg cramps or fatigue when walking are often brushed off as aging or arthritis. Meanwhile, the disease is silently progressing. I had a patient once who thought their leg pain was just a sign of getting older, but by the time they came to me, they had a foot ulcer that wasn't healing because of poor blood flow. We caught the PAD just in time, but it could have gone so much worse. This is why early diagnosis matters. If we catch PAD early, we can often prevent amputations. Yet here's the heartbreaking part. Black Americans are twice as likely as white Americans to lose a limb due to PAD. This is not just a medical issue, it's a systemic one. Here are the signs of PAD you should never ignore. Leg pain while walking, especially if it goes away with rest. Cold feet or toes, especially if one foot feels colder than the other. Wounds that just won't heal, particularly on your legs or feet. Discolored skin, so look for a bluish or pale appearance. Thickened toenails or hair loss on your legs, which is a subtle but significant sign of poor circulation. If you notice any of these signs, it's time to see a healthcare provider and ask about PAD. Don't wait. It's better to get checked early than to regret it later. Diagnosing PAD isn't very complicated. It starts with a simple test called the ankle brachial index, or the ABI. This measures blood pressure in your arms and legs to see if there's a difference, a key sign of blocked arteries. In more complex cases, doctors might use an ultrasound, CT scan, or angiography to pinpoint the blockage. These tools help us figure out the best course of action. Treating PAD is all about restoring blood flow and preventing further damage. Here's how we do it. There are lifestyle changes like quitting smoking and eating heart-healthy foods, also getting moving. Even a 30-minute walk a day can improve circulation. There are also medications like blood thinners, cholesterol-lowering drugs to improve blood flow, and it can make a big difference. In advanced cases, we use angioplasty or stents to reopen the arteries. In severe cases, bypass surgery might be needed. And remember, managing diabetes and high blood pressure is critical for preventing complications. Here's what I've learned over the years. PAD isn't just a medical issue, it's a public health crisis. Every year, thousands of amputations could be prevented with earlier diagnosis and better care. But to fix this, we need awareness, better screening, and equitable access to treatment. So if you or someone you know has risk factors like diabetes, smoking, or history of heart disease, don't wait. Talk to a doctor about PAD. PAD is serious, but it's also preventable and treatable if caught early. Don't ignore the warning signs. Take charge of your health today. Thanks for watching. If this video helped you, check out my next video on how to care for your legs and feet. Stay informed and heal well.